Welcome to another online PowerPoint presentation. I am Stephen Teal, Partner and Director of Legal Research at Gardner Roberts, LLP. I have been a research lawyer for nearly 30 years. In this presentation, I will be discussing issues related to the return to play that is being considered by the National Hockey League. The NHL's return to play is important to Canada because of its 7 Canadian-based teams and the fact that a Canadian city is being considered as a hub city for the playing of games. The global COVID-19 pandemic has had a significant impact on our societies. In sports, the pandemic has caused the cancellation of the Summer Olympics and caused professional sports leagues around the world to suspend play. For sports fans, the suspension of play deprived them of cheering for their favorite teams, either from home, at a stadium, or at their favorite restaurant or sports bar. The economic impact has been staggering. While sports channels have aired reruns of classic baseball games or hockey games, it is certainly hard to watch these reruns from start to finish because the end results of who wins and who loses is already known. It is not as though we have traveled back in time, armed with knowledge of the results of a game, so that we can place winning bets like Biff Tannen in the Back to the Future movie franchise and anticipate a lucrative windfall. But all around the world, as the worst of the COVID-19 health emergency appears to be behind us, professional sports leagues are returning to play. Baseball in Korea is alive and well. In Europe, soccer leagues like the Bundesliga are back in action, even though there are no fans in the stadiums and substitutes are being required to wear masks and physically distance while their teammates engage in action. The National Basketball Association will be making Disney in Orlando its home as it prepares to return to play. The National Hockey League is also getting ready to hit the ice with games to be potentially hosted in Canada. Briefly, the NHL suspended its 2019-2020 hockey season on March 12, 2020. At that time, most teams had played somewhere between 68 and 71 games. While for some teams it was either clear that they were going to make the playoffs or were not going to make the playoffs, there was still some anxiousness faced by some teams who were battling to make the playoffs or simply trying to improve their position in the standings so that they could secure home ice advantage. Play then suddenly stopped as the COVID-19 health emergency became more widespread, as professional athletes in some sports began to test positive, and as North American governments began to declare states of emergency, which included imposing travel restrictions and shutting down businesses. Players were told to return home, and for professional hockey, this meant that approximately 17% of the players left North America for their overseas homes. The National Hockey League's return to play can be found in a 22-page memorandum that is dated May 24, 2020. In this memorandum or plan, the league has adopted a phased-in approach to the return to play. The plan includes, among other things, information related to travel, testing, temperature and symptom checks, education, permitted activities, and permitted personnel at team facilities. The plan also speaks to issues of physical distancing, the use of personal protective equipment, and discusses other safety measures that should be followed to ensure that athletes and staff are protected from contracting COVID-19. With respect to medical testing, the league has adopted an overriding principle that any testing must be done in the context of excess testing capacity in places where the teams are located. Player and organization testing, the plan states, should not be depriving the needs of healthcare workers, vulnerable populations, and symptomatic individuals from receiving a test. The league has also advised that testing is a secondary measure to the need to follow good hygiene practices, to maintaining physical distancing, and to keeping facilities clean and disinfected. Testing is expected to take place on an ongoing basis, and where it is not available, players and team personnel must self-quarantine for 14 days before they can enter a training facility. Temperature checks will also be required for players and personnel who will be entering team facilities. Checks will be required no more than 2 hours before a player is expected to arrive at a facility, and teams will be required to also conduct a second check at the entrance of the facility by a qualified individual. The NHL's protocol contains a section about COVID-19 symptomatic persons. It explains that where a player or other personnel develops COVID-19 symptoms, team medical staff must be immediately notified. The individual is also required to self-isolate and is to be evaluated. Medical staff are required to consult the team's infectious disease specialist and administer PCR testing. A player who is diagnosed with COVID-19 will be immediately designated as unfit to play and will be removed from training, practice, or playing activities. Players and club officials are also expected to immediately contact the team's medical staff if he or she has come into contact with someone that has COVID-19. Where someone within the organization tests positive, teams will be responsible for contact tracing, which should be done in compliance with regulations from local health officials. Contact tracing permits identifying others who have been in contact with the person who tests positive. While players will be allowed to participate in both on-ice skates and other training, the activities in which they participate in will need to allow for appropriate physical distancing. On-ice activities will be limited to only 6 players at a time, and no other personnel will be allowed on the ice. Indeed, only 6 players will be allowed into a team's facility at a time. For a brief period of time, coaches and hockey operations personnel will also be prohibited from observing the on-ice skates. Once they are allowed to participate, they will need to be seated in an area that is separate from the players, and they will not be allowed to have contact or interactions with them. Where local government regulations do not permit groups of 6, or where a team's facility does not permit 6 players to physically distance within a space, the number of players who can attend at the facility will need to be reduced accordingly. The plan further requires players to maintain a 6-foot physical distance from each other at all times, both inside and outside the team's facility, and they will be required to wear personal protective equipment, such as a surgical mask or cloth face covering, when entering or leaving a team facility, or when inside when physical distancing cannot be maintained. Other personnel will also be required to use PPEs when in contact with players or when in a team's facility or entering or leaving a team facility. The NHL is hoping to return to play starting sometime in late July or early August, with training camps also starting in the early part of July. The league's blueprint is to use 2 hub cities for play that will involve a 24-team playoff format. Among the 2 hub cities being considered are 3 Canadian cities: Vancouver, Edmonton, and Toronto. Whether professional ice hockey will be played in either Vancouver, Edmonton, or Toronto, however, will depend on whether the travel restrictions between Canada and the U.S. will be lifted in time. Currently, there are travel restrictions in place between Canada and the U.S. until June 21st, 2020. Those restrictions only permit designated essential travel across the border, and professional athletes are not among the workers who are deemed essential. Optional and discretionary travel is not allowed. What is considered non-optional or non-discretionary travel during COVID-19 can be found in the policy, procedures, and guidance used by Immigration, Refugees, and Citizenship Canada staff. But even with the chances that a travel restriction could be extended beyond June 21st, 2020, the federal government can choose to deem activities associated with professional hockey non-optional or non-discretionary. Border officers can also make an assessment whether to travel to Canada is non-optional or non-discretionary. Thanks for watching this presentation. Remember, this presentation is not intended to be legal advice and does not necessarily represent the views of Gardner Roberts, LLP. You should always consult a lawyer when seeking or needing legal advice, and please keep in mind that government measures and announcements in connection with COVID-19 can occur almost daily. Don't forget to like this presentation, and please don't forget to subscribe to this YouTube channel.